My story begins back in April of 2009 when I had just completed a 5K race. I was having some symptoms and had gone to see a doctor, and I was diagnosed with a tumor on the inside of my spinal cord from C4 down to T2. I had surgery to remove the tumor May 19th of 2009. It was benign. I then had 25 days of radiation, but what it had left me was a paraplegic. I didn't have any movement from the waist down and limited movement in my arms and hands. And so I went and I sought out Dr. Berger, who was my rehab physician, and we put a plan together and set us on a course of pretty intense physical therapy.
I'm Dr. Berger. I'm a physical medicine and rehabilitation specialist in Overland Park, Kansas. Shantelle presented with paraplegia. She had the inability to move the lower half of her body. It was secondary to a spinal cord tumor, and as she began to heal, she had a lot of pain and a lot of spasticity, which is uncontrolled spasms of the lower extremities. What happens is that the muscles weaken as a result of the spinal cord injury. There's two controls. There's an override of the neurological system secondary to the spinal cord disinhibition, and there's muscles that begin to become very tight. Those muscles maintain actual strength. Other muscles become weak and can't control and balance.
I was in therapy about 4 days a week. For a while there, I was in a day program, which I was in therapy all day long. Just working on just trying to get some strength back, some upper body strength back, being able to just sit at the bedside or sit at the end of my chair, which was very difficult for me.
She started off at bed prone, not being able to move. She was not even moving her arms very well, and initially she had some arm weakness. That eventually resolved. She had a lot of complications. She was not able to sit up in a chair. She was not able to transfer, meaning get out of a chair. And physical therapy and occupational therapy, starting inpatient with an extensive inpatient care and eventual further surgeries and more inpatient care, she was able to progress to a point where she was able to attend to normal activities of daily living at a chair level. She expressed the desire to go further, and we put her into a physical therapy program to work more aggressively with newer modalities.
I then went to therapy at Mid-America Rehab, where I was introduced to E-stim, which is electrical stimulation, which is very, very intense stimulation to the muscle. And the product that I was using was Kneehab, and it was just a constant stimulation to that muscle, just to try and waken that muscle up. And after using the product for about 2 weeks, I was able to stand, which was pretty impressive. And continuing that progress in therapy, my therapist said, "You can stand, let's try and take a couple steps." So having a little bit of fear, I said, okay, let's try it, and I was able to take 15 steps. So I attribute that success to the Kneehab product. Without that constant stimulation of going to my quad, sending that signal back to my brain, I don't believe I would be where I am today. And I do wear, again, on both legs for 20 minutes, 3 times a day, and I can wear it just sitting in my recliner at home. The last 20 minutes I do it right before I go to bed, and I take it off, and I'm good till the next morning. If I'm just around the house, I'll wear it underneath my clothing, so I can just hit my controller and set it for 20 minutes, and away I go, doing whatever I'm going to do in my house. And that's kind of how I utilize the Kneehab.